If you have lost one tooth, you need to replace it. Why? Because you need to eat well to keep yourself well. Second thing, you need to smile well, so it is very important that you put the teeth as natural as possible. Best thing is to keep your natural teeth. But if you have lost one, you need to keep a tooth that can replace the natural tooth or the artificial tooth which doesn't move around. An artificial tooth which can stay there for a quite long time. Before, we used to put a tooth which is removable, a removable partial denture. Most of the time, when the patient talks, the removable partial denture will move a little bit. It is very embarrassing for the people to look at it, and it is very embarrassing for the patient to wear it, because every now and then it will start moving. They have to put it back. Nowadays, you don't do that. What you have to do is, you have to replace it using fixed prosthesis, either an implant or a bridge. What is a bridge? What is an implant? Most of the time, we change from here to there. What is an implant? Wherein you have to put screws onto your bone and then you replace the tooth. You put a screw right onto the bone and then you put a cover on top of it. That gives you a tooth which stays just like your tooth. What is a bridge? That is wherein you put the tooth by the support of the rest or the neighboring tooth. How can you do a bridge? You have to take out around 1 to 2 millimeters of your tooth material all around the tooth and then put the tooth over there. Fixing the tooth to the rest, both the side tooth, is called as a bridge. Just like a bridge, you have two poles on the either side, and then you have the area which you will walk in. That is why it is called as a bridge. Is there any problem if you do a bridge? There is no problem, because whatever tooth material you are reducing, you are adding it. So it is very important that you have good support on both the sides. If you are replacing one tooth, you need to be supported by two teeth, so that these two teeth will do the job for three. So you should have firm, good teeth to support. If you don't have firm, good teeth to support, you need to go for an implant. If you have a good natural teeth, you don't have to go for an implant, because implant itself is a foreign body. So first time you get an infection, the body will try to take out all the foreign bodies from your body. So you might have a failure of an implant if you end up with diabetes or with an osteoporosis or a major infection in your body. So it is much better to keep your natural teeth and to keep the bridge on a natural teeth rather than implant. But implants are good wherein there are no natural teeth to support the tooth. Whether we can replace the last tooth? Yes, we can do. Even if you don't have a tooth in the back side, you can replace the rest of the tooth by using cantilevered bridges, or we can even use precision attachments. That are attachments which are placed on the tooth that the posterior teeth can be attached to it and still use it for chewing, and that too very confidently. When you replace a tooth, you are not only replacing a tooth, you are also restoring the vertical dimension. Or you might have seen people who are elderly wherein your jaw comes in front. Why? Because they don't have the tooth to support. It slowly comes forward, and then their speech itself might have changed. So to have good speech also, you need to have good teeth to support. That is, in the posterior, you need to have good teeth, and whenever you want to say something like "th" or teeth, you need to have good front tooth which is not movable. Otherwise, you will not be spelling it well. Okay, especially when you speak S and things like that, if you need to clearly speak it to them, you need to have front teeth which are very permanently fixed. So it's very important for phonetics, it's very important for your smile, it's very important for you to chew. So I think it's very important that you place permanent good teeth which can serve you for quite a long. It can be given with warranty in India. So come to India, get the treatment done, and you will definitely have a good smile. Have a good day.